the Thursday, March 11th Board of Inspectors meeting to order for Center County. And we are going to, at this time, accept any public comments for items that we do not have on our agenda today. If there's any public comment, you can feel free to unmute yourself and offer it at this time. Okay, hearing none, we will move on with the approval of the. I'm sorry, go ahead. Okay, must have been just somebody's mic echo there. We are going to go to the approval of the minutes from our last meeting in February. Is there a motion to approve those minutes?
So moved.
Second, Commissioner Higgins.
It's been moved and seconded. Any final discussion on the minutes? Hearing none, all in favor say aye. Aye.
Aye.
Aye.
The motion is carried. All right. Going on to our next set of items, we're going to turn it over to Warden Shell for his monthly reports. Good morning, Chris. The floor is yours.
Good morning, everybody. Thank you very much, Commissioner Pipe. Starting off with our returning citizen services report, Center County Mental Health, Amy Miller. She's still doing call-ins. We sure miss her. Be nice if her come in sometime. We'd be happy. February last year was 64. February of 21 was 9 she's seen. She referred 3 to PSU site and 6 to Crossroads Mental Health. Dr. Wolf is virtual meetings. He's seen 7 returning citizens past month. Crossroads virtual meeting, drug and alcohol, 1 male returning citizen 4 times per month. Mental health group. Somebody's not muted. Mental health group, 5 male returning citizens 4 times per month, 1 female returning citizens 4 times per month. Our Center County Compass program was on suspension, but what they did was they worked one-on-one with a couple of, probably about 6 individuals, 6 males and about 3 females. They worked individually to get those through to graduate. So the graduation's coming up in a week or so here. Work release and community reentry, centerpiece is suspended currently, county maintenance 0, grounds we have 2, work release is suspended currently, and 2020 we had 5 on work release. Our prison monthly report on our population, the snapshot was February 28th of 2021, our total count was 145. Center County population was 113, 17 females, 96 males. Unsentenced was 81, 13 females, 68 males. County sentence was 21, 4 females, 17 males. State sentence is 11, 11 males. We do have dates on those to go to state if nothing changes with the state. Tentative county population is a total of 32, 12 females, 20 males. Unsentenced is 28. 9 females, 12 males. County sentence is 12, 2 females and 10 males, and we do not have any tentative county individuals going to state. Our snapshot for our month totals here for February 2021 daily population as you go. We started off beginning of the month with Center County population at 113. We kind of ended right around 113. Tentative County, we started off with 144 and we ended down to 33, 32 numbers. So that's just our monthly graph. Returning citizens report here with behavior modification status. We have 2 on tier 0 and we have 15 out in population. Our co-occurring disorder, February of 20, we had 34. Our intakes was 134. This past February, we had 1 come in. That was a co-occurring disorder with 38 intakes, comes out 38%. 0 was on medication. 1 was from center, 1 male. Suicide watch a year ago was 17. This past year was 11. 5 from center, 1 female, 4 males. 2 from out of county, 1 female, 1 male. Out of the 11, 2 was detoxing, 2 was from center, and there are 2 males. Detox total a year ago was 34, 18 from center, 16 from out of county. This past February we had 11, 4 females, 7 males. 10 was from Center County, 4 females, 6 males, and 1 from out of county was a male. Our substance detox by the numbers, heroin takes the top with 4. They are all out of Center County. Benzo is next is 3. They were from Center County. one on meth from Center County, one on alcohol from Center County, and we had 2 come in on heroin and benzo from Center County. FIMAT is currently suspended right now due to COVID-19. We're trying to work with the, trying to open this back up as soon as possible, so we're trying to get things moving forward on that. Prime care report, inpatient hospital, we had 1 for a total of 5 days. That was due to COVID. Our COVID-19 test results, symptomatic testing was negative, it's 264, recovery 75. Asymptomatic was negative 256, positive is actually 6 as of today, with a total of 39 being recovered. Those numbers were from last week, but today's numbers was a little different. Total seen by physician or PA a year ago was 72. This past February was 64. Total medical transportation to outside physicians a year ago was 20. This past February was 13. Our mental health clinician individuals seen a year ago was 219. This year was 256. Psychiatrist is 76 a year ago, and she's seen 76 this past month. Mental health patients on psychotropic medications a year ago was 147. Our ADP was 223 with a 65.9% on psychotropic medications a year ago. This February was 92 with an ADP of 150, comes out to 61.3 of our population. Daily average patient diagnosed with mental health is a total of 108 out of 150 ADP. Category C a year ago was 119, 53.4%. Category D was 33 with 14.8%. This past February was 79 of category C with 52.7. Category D was 17, comes out to 11.3% of our population. Our mental health stability ratings, entire population, stability code A, which is in the green, is 19, that's 13%. Stability code B is 27, is 18%. Stability code C is 78, is 53%. Stability code D is 17, 12%. Totals of 141. Awaiting placement was 6, with our total population of March 3rd, 2021 was 147. Our mental health stability rating by county, starting with stability code A, is 17, is in blue, is from center, 17 males. Green is from out of county, 2 males. Stability code B, out of center, is 21, 21 males. Out of county is 6, 2 females, 4 males. Stability code C, Center County, was 62 with 14 females and 48 males. Out of county was 16 total, 6 females, 10 males. Stability code D is blue, is Center County, is 9 males. Out of county is 8, 3 females, 5 males. Inmate grievances report. A year ago we had 20. Past February we had 38. 5 was non-grievable, 0 found it. Grievable were 12, 0 found it. 1 appealed to the first step, and 0 amended, and 0 was appealed to the second level, and 1 was refused. Central Booking Center, total numbers. A year ago we were at 174, or I'm sorry, a year ago we should have been 285. Our total bookings this year was 174. We're down 111. 11 and 7 was 28. 7 and 3 was 27, and 311 was 119. Just want everybody to know that Wilmer Andy Andrews, Central Booking Coordinator, is retiring after 34 years of service. On Wednesday, March 31st, 2021, from 12 to 2 p.m., we're going to have a virtual retirement gathering, and we're going to have anybody that wants to come in person have a sign up. We're going to have limited access during certain times that you can come in for a half hour to 45 minutes, and then you can leave and allow somebody else to come in. So we're going to have a sign up as well as a virtual retirement gathering for him, and that link will be sent out this week. Oh, that's it, sir.
Okay, thank you, Warden. Any questions, anything we wanted to discuss in the Warden's monthly reports? We'll start with prison board members, and then we'll go with any other questions. So first with the prison board. Any questions with the prison board? Okay. Chris, one question in terms of the asymptomatic testing, if you could just do a quick refresher. How are we still, because we know we did a large batch several weeks ago of individuals. How are we approaching that now in terms of the returning citizens that are incarcerated?
So everybody that comes that is brought to our facility, that we do a rapid test on them, and if they're not having any symptoms, they would fall under the asymptomatics. If they're having symptoms and they come up positive or negative, that would fall under symptomatics. Anybody in the institution that we test after the 14 days or after they go under quarantine at day 12, we'll test them again. If they still have no symptoms and they come up negative or they come up positive, if they have no symptoms, they'll be on asymptomatic. Symptomatic would be if somebody had a symptom, a cough, cold, runny nose, headaches, and so forth. And any other returning citizens that's incarcerated in our facility that comes up with a symptom, any type of symptoms that falls under COVID-19, they will be tested, and they would be a symptomatic testing. They would fall under that category, sir.
Okay, thank you. And then in terms of the staff testing, we are currently not conducting any asymptomatic testing in that regard. It's where if a staff member has symptoms, they would then be able to test outside with their healthcare entity or quarantine or isolate if they came in contact with somebody. But we're not doing any within the facility currently for staff. Is that right?
What we do is anybody that wants tested, we test them. So all they have to do is request, hey, I feel I want to get tested, we'll test them. If they were exposed to anybody out in their home, on the street, however in the community, what we do is we recommend them to quarantine, and then we will test them. We would have them come here to test, or they get with their physician and test there. So yeah, we're still very open on anybody wanting a test. We have no problem, symptomatic or asymptomatic. We will test the individuals.
Okay, thank you.
Mm-hmm.
Any other questions before we open it up to any public comment? Okay. We do have one question or a comment. Janet Irons.
Yes, hi. Thank you, Commissioner Pipe. Can you hear me?
Yes.
Last month you couldn't hear me. Okay, good. I just had a quick question about the general population report for out of county. The numbers didn't add up, and I'm just wondering what the correct answer is. So I think that 28 plus 12 is 42, but it says 32.
You're correct on that. I'll have to go back through. Hold on, I have that right now. I can check that.
Thank you.
It's actually 20 unsentenced. I apologize. Looks like I have an 8 here, but it's actually not. It's a 0, so it's 20. So it's 20 and 12.
Great. Thank you so much.
Mm-hmm.
I had a question.
Please, yeah, thank you for catching that, Janet. And then Connie, please.
Could you explain the procedure when a person has to go out to the physician? What happens to them when they return?
When they have to go out to the physician, so they go out. When they come back, we give them all new linen and everything, or new clothing. They shower and they come back, and then we put them on a monitor that we watch them on quarantine till they don't have any symptoms. If they don't have any symptoms, and we usually do a test. So they come back and we quarantine them.
So a person who has a weekly visit to the doctor then is quarantined all the time?
No, there's nobody that has a doctor visit every week.
Okay. 13 is a lot. You reported 13 doctor visits this month?
It's a lie?
A lot.
Yeah.
L-O-T. A lot.
Yeah.
Seems like it's a lot.
Yes. I mean, They're going out to specialists. That's usually where they're going to go out to, the specialists. I'm trying to think.
I get my point is I'm concerned that they're having a lot of isolation by having to go out to a physician's visit.
I understand that, but we also have to make sure that they're not carrying anything back to expose anybody within our housing unit. So we try to use all precautionaries as possible.
Thank you.
Mm-hmm.
Thank you for that, Connie. Any other questions from members of the public prior or before we get to our next set of agenda items? Okay, seeing no further questions, we will move forward to old business.
Referring back to the old business with the data collection, we're still working with probation as well as with our Global Tel link with the report. It's getting closer. However, it's just trying to pull the intake, the probation, parole, and bench warrants, trying to pull that out of the information out of our OMS, offensive management system. So trying to pull that correct data out is pretty difficult on the backside. On the front side, we can see it, but we'd have to do everything manually, which would take hours and so forth every day to come up with the proper numbers. So we're still working on that. Pretty much got the list knocked off except the last one with the intake emissions with probation, parole, and bench warrants. So that's why we're working with probation right now and seeing what their system has and how we can link ours with theirs and kind of make one big report.
Fantastic. Thank you, Warden. Yeah, it's GTL, from what you've reported before, has been great to work with in this regard and make any modifications we'd seek. So it's great news on that account.
Yes.
Any questions? Yeah. Any questions related to the update on data collection from any members of the prison board? Okay. Any members of the public wish to make any questions or comment at this time? Okay. All right. We'll move forward then with our next old business item in terms of the COVID-19 operations.
Yes, we're just reviewing our programs. We've added a reentry strategies. We had their first class end. It went very well. We're pretty pleased with that with Mark Fraley and his group with everything. So we just added that. That's in the blue. Everything else we've been doing, everything's back into working right now. Nothing's suspended at this time for the virtual meetings. The phone calls are still continuously. That's just really, there's a lot of phone calls being conducted by the counselors today trying to make sure we accommodate all the returning citizens with all their needs under those categories there. In person, Compass, they're going to be starting back with a bigger group once these individuals graduate and they can start with a new group here shortly. Visitation through the non-contact room meetings. We've been doing this, but I actually missed it on last month. But interviews for Public Defender's Office, we have Kate Hall coming in every morning. Mostly she comes in and interviews people for the Public Defender's Office. That's been going great. It's in process. I talked with Kathy Brown about a leadership program. She actually brought it to my attention, and it's in very early stages, but I just wanted to put on there that we're working with Centerpiece, with our reentry specialists. Our reentry counselor, Lorenda Brown, will be working with Kathy and some other community entities there to make a leadership program. So I really appreciate that. I know, Kathy, I know we don't have much to say about it, but it's something that we're going to be working together with hand in hand that's coming up here shortly.
Yeah, absolutely. I'm very excited about that.
Thank you. Looking at COVID-19 future consideration for Tennessee County returning citizens. What we're asking the board is our female population is very, very low. And we're just Huntington's been asking, since we have such a great relationship with Huntington and been working with them, they want to know if we could just start taking their females at this time.
So for board discussion or board questions for the warden, any questions relating to beginning to have returning citizens from Huntington County starting to increase that again? Any questions or feedback on that? Thoughts?
Mike, this is Jason. I guess my only question would be, do we know what Huntington's COVID positive numbers, or what their numbers are looking like?
These would be individuals coming right from the street. So they'd be picked up by their probation, or they'd be picked up by the police department. They would come in, and we would treat them like any other new commitments that would come in with the testing right away, our commitments, quarantines in our quarantine unit, and so forth.
Okay, thank you.
And they would, and essentially to expand on Jason's question, they would go through the same processes that anybody from Center County would be going through as well. We would not rely on Huntington County to do the testing at their facility. It would still be on our end.
Correct. That would, yeah, and everything would be billed to them.
Got it. Got it. Any other questions from the prison board on this? Okay. Would the consensus, would we be comfortable with, again, accepting Tennant County returning citizens from Huntington, female returning citizens at this time? Are we comfortable with that direction? Any hesitancies on that from anybody on the board?
No.
Okay.
No.
Okay. Okay. Any questions from any members of the public regarding this? Comments? Okay, Kathy, please.
Yeah, does this mean that you are getting closer than if you're accepting individuals from other counties, contracts from other counties, that you're closer to releasing individuals for work release or for community reentry?
There could be a possibility in April we're looking at, but that's when we'll bring it back to the board. As long as our cases are low, if we can get vaccines in our facility, that would be a big plus, especially to our returning citizens. So that's what we're looking. You know, we have a far goal as possibly, but we're going to possibly bring it back to the board in April. But we want to see how the numbers are in our community and go from there.
Okay. Thank you.
Mm-hmm.
I think Janet also had a question.
Yes, hi. Actually, I had a question on the previous slide or two back. In terms of the list of organizations that are kind of partnering with programming. And it's not really programming, but I just wondered, where does Center Safe fall on this? I didn't see it anywhere, and I know that they've been interested in making sure that they can do counseling.
That would fall under any virtual or any phone calls that we need to. We've reached out to her. We reached out to Ann several times for some females and males to talk with them and so forth. And if they ever needed a virtual meeting, we would set that up as well. These are. Oh, I'm sorry.
I'm sorry. So does it belong on this list, or?
It kind of folds on both lists, where we make the phone call to them, and a lot of times they'll do a phone call interview with them, and then if they need to do a virtual meetings, we can virtual meetings up. These are the programs that are up here now on the screen now. The virtual meetings, they happen usually every week throughout like sessions. So these are our regular ones. Center Safe would be one of those if we have a circumstance on a individual that needs to talk to Center Safe. We would link them in there with a phone call, and then if they need virtual meetings, if they need weekly meetings, we would set that all up on their request.
Okay, thank you. I just I don't want them to get lost, and so I think they perform a really important service. So I was just hoping that they could somehow get recognized as a partner in some of the work that you do.
Yeah, they are a key asset to us. So yes, they are. We would not exclude them from anything. We're in contact with them not on a regular basis, but as we need them, and then we always let them know if they have anything they need to reach out to us. We are very willing to work with them.
It's a great point, Janet, and the sense is that this is not an all-encompassing list, where there are organizations that we work with on a ad hoc basis, I guess you could say, and doesn't, if their name is not up on this list, doesn't necessarily mean that we don't work with them. But it's a good point. Yeah, we certainly do not want to get those important groups getting lost in the conversation. Okay. Any other questions from members of the public before we move forward? Okay. So at our April meeting, we would then look forward to getting maybe an update, Warden, in terms of how that's going with the Huntington correctional facility and with individuals getting some more Tennant County inmates from them. So we look forward to that discussion. Thank you for bringing that to our attention. And it looks like we have one final item to our topic with any potential updates you might have on the on COVID vaccine for incarcerated individuals and our staff.
Yes, we still don't have any vaccines. I think we have about 25 staff that actually got the vaccine completed, the second dosage. We're trying to, Prime Care is working with the Department of Health, trying to get them brought in here. We were hoping that it would be brought in here last month. However, it's just on hold right now. I know Prime Care has been working with us. We've been trying to work with Geisinger and Mount Nittany, and like I said, it's everybody's on a waiting list, and we have to wait, and especially for our correctional officers. If in the community we have to wait to 1B, but that's what we're hoping with Prime Care. It works out a good plan with the Department of Health. That's what we're hoping for here shortly.
Absolutely. Okay. Thank you, Warden. And we'll have this on our meetings going forward. There may be no updates. We may be in the 1B category for some time now. We'll wait and see, but it's just important to keep this on our radar as we go forward. Any questions from members of the prison board when it comes to vaccine for our staff and individuals incarcerated? Okay. All right. Hearing no questions. Any members of the public that would want to make any questions or comments on that topic? Okay, seeing none, we will move forward then, and I believe we're going to be heading into our, so just to clarify, Warden, or confirm, we have no new business for this meeting, correct?
That is correct, sir.
Okay, all right, we'll move into our, thank you for all that, Warden. We'll go into our monthly reports, and we will turn it first over to Carrie Hall.
Good morning. I don't have any report to offer for this month's meeting.
Okay, thank you, Carrie. In Prison Society, we have a few members from there. We have Janet on the reports, but Janet, would you like us to start with you? Turn it over to you.
Sure, that would be great.
Okay.
We have one thing that we wanted to bring to your attention. We've been following issues having to do with anti-discrimination efforts by the jail regarding LGBT people, and we're interested very much in what the policies of the facility are, and we're also interested in how those policies are communicated both to the staff but also to incarcerated individuals, because a lot of times the issues that develop are between two incarcerated people, and how do we indicate that those policies apply to everybody in the facility. So we did file a right to know request to get a copy of those policies. We did get a reply saying that we had to wait for 30 days. So that was on Monday of this week. So we are anxiously awaiting a look at those policies. And that's all I have.
Okay, thank you, Janet. All right.
I'll just say I submitted our report from the last parenting session, and if you had any questions about that, I'd be happy to answer them. And otherwise, I am planning to discuss with Jeff Haidt when we can potentially schedule the next Parenting Inside Out program.
Thank you, Connie. And for the prison board members who we were, and I believe that you're also, let's see here. No, we get a separate email packet of the agenda items, but that was on our packet for this month. So we will certainly review it. And if we have any questions, we'll let you know about that, Connie. But thank you for sending that as always. We would love in the future, just keep on sending them so we can continue to take a look at them. Okay. Any questions there for anybody from the for the Prison Society? We'll offer it that way. Okay, seeing none, we will then turn it over to Kathy from Centerpiece.
Good morning. Center County Community Conferencing is not up and running, but soon to be up and running. We have our two, we have a program coordinator and a facilitator coordinator that we've hired for it. We will have training on April 15th, actually a presentation. It's a stakeholders presentation. So a lot of people on this call will probably be getting an invite to that, in which Lauren Abramson, who put the program in Baltimore in 1995, will be here to present about the program and just kind of inform everyone how it worked, how it can work, the benefits of it. So that'll be a stakeholder meeting on April 15th, and you will be getting information about that. Centerpiece was very, very happy to receive a phone about transportation that was needed for a returning citizen that has to go to Butler. We're happy to provide that. We also got a phone call from the warden about a walker that was needed for a returning citizen. We're happy to provide that. You know, those are things that I don't know that we've really done in the past, but we're certainly open to it and very happy to do that and be able to serve in that way. Just to touch on the leadership program that the warden had mentioned, it was one of those 2 a.m. in the morning thoughts of, if we have leadership Center County for the future leaders, the best, the brightest, the people we hold up, why can't we create something like that for returning citizens to integrate them into the community, to teach them about how government works, to teach them about the nonprofits, to teach them about the community as a whole and let them make connections. So I did reach out to Zach Barton at Leadership Center County. He's excited about what could come of that. I reached out to the warden. He was on board. So I'm gathering people together now that we can create a program like that for returning citizens. I think it has tremendous potential. I think it could be a very cool thing, and it's just another way that we can help facilitate transitioning returning citizens back into our community. So we'll see where that goes, but I'm very optimistic about it. Thank you.
And this is coming on the tail, or I guess coming parallel or at the same time even as the conflict resolution program being developed. So this is great, Kathy. Very, very exciting. We appreciate the creativity.
We got a lot going on over here.
No, you're bursting at the seams, or we can't wait until we can start to really, get past all this. So it'll be exciting. So thank you for your so thank you for the energy. Appreciate it. Thank you.
Absolutely, thank you.
Okay, that is our final report. There we are looking at our next meeting as the warden has on the slide here. Thursday, April 8th at 8 a.m. We will still keep it virtual for the time being. Any other discussion or questions we would have before we would look to adjourn this morning's meeting? Okay, seeing and hearing none, we look for a motion.
Motion to adjourn.
Second.
Okay, it's been moved by Controller Moser, seconded by Sheriff Samsel. All those in favor say aye.
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 The motion carries. We are adjourned. Have a wonderful day, everybody. Bye-bye.
Okay.
Good day.
Hello, Kathy. Can you hear me? Guess not.